I'm a consultant orthopaedic knee surgeon with over 20 years of experience. I focus solely on the knee joint in both my NHS and private practice. And I pretty much deal with the full spectrum of knee pathology across all age groups. Most of the patients who come to me are often recovering from a knee injury. They've often got over the acute phase, but find that the knee still doesn't feel right. The knee might feel a bit wobbly. They might be experiencing a sensation of the knee giving way, or the knee might just not feel strong enough. Sometimes they can hear popping sounds in the knee, or sometimes the movement itself is restricted, as in they can't bend the knee fully or are unable to straighten the knee fully. At the other end of the spectrum, I will also see patients who present a bit later in life, often with conditions like arthritis and degeneration in the knee, which can be managed conservatively or by treatments like a knee replacement. Now, coming to meniscal injuries, so the menisci are C-shaped elastic structures which are sandwiched between the two bones in the leg. This is the lower bit of the thigh bone, which is called the femur, and the upper end of the shin bone, which is the tibia. And the menisci essentially act as shock absorbers, and when we jump or load the knee, they will tend to dissipate the forces across the entire joint surfaces, thus protecting the joint. And increasingly, menisci are being recognized as contributing to knee stability. We have two menisci in each knee. There's one on the inside called the medial meniscus, and there's one on the outside called the lateral meniscus. And meniscus injuries are very common. You could commonly injure your meniscus while playing a sport, such as football or rugby or a netball. And the mechanism is typically a twisting force on a bent or a loaded knee. One could hear a popping sound. Sometimes the trauma can be fairly innocuous. It might be just twisting your knee when you're getting out of the car, or twisting your knee while you're dancing. The symptoms could vary depending on how you've injured the knee and what are the other associated injuries. Often you can tear your anterior cruciate ligament at the same time when you sustain a meniscal injury. You might hear a popping sound in the knee and might experience some discomfort on the inside or outside of the knee. Sometimes the knee can get locked, and this is a special type of tear called the bucket handle tear, when a fragment of the meniscus is stuck inside the center of the knee, which prevents the knee from being able to be extended fully. As far as the treatment is concerned, when I see you in clinic, the first thing that I will do is take a detailed history if there was any injury involved. This will be followed by an examination of the knee, where I will try and elicit physical signs which might guide me to the diagnosis. Many patients will require further investigations, such as an MRI scan. The treatment of meniscal injuries can be both conservative, that is non-surgical, as well as surgical. Many meniscal tears can be managed without surgery through activity modification and strengthening exercises involving physiotherapy. If, however, you continue to remain significantly symptomatic despite conservative treatment, or are experiencing mechanical symptoms such as the knee locking or the knee getting stuck, then surgery may be an option for you. And surgery for a meniscal tear typically involves a knee arthroscopy. This is a fairly straightforward day case procedure where an arthroscope, which is a small camera with a light source, is inserted into the joint through a tiny incision, and this allows me to get a great view of the structures inside the knee, including the meniscus and other structures like the cruciate ligament. I can then make a second small incision and insert an instrument through which I can treat the meniscal tear. Typically, meniscal tears, surgical treatment would involve either repairing the meniscus or just trimming the meniscus. My philosophy is always to try and preserve the meniscus because they are crucial to protecting the joint, and it's important that you choose a surgeon who does a high volume of meniscal repairs and is proficient in meniscal repairs. And the other option is to just trim the meniscus. I will discuss the options before surgery with any patient, and whether a meniscal tear is amenable to repair would depend on factors like the configuration of the tear, the location of the tear, the blood supply in the region of the tear, and the chronicity of the tear. So following your surgery, the recovery actually is much quicker following the trimming of the meniscus. If I repair a meniscus, which is always the first and preferred option, then we will try and protect the meniscal repair for 6 weeks, and which commonly you will be in a brace to protect the meniscus for the 6 weeks and avoid activities like deep squats. And most people will be back to normal by about 6 weeks. You will of course require some physiotherapy to continue trying to strengthen the muscles around the knee following your surgery. So if you have had a knee injury and the knee is not getting better and you are experiencing some of the symptoms that I described, then my advice would be to see a knee specialist to help you deal with the condition.